Imagine feeling like you're drowning, all alone, and no one can hear your cries for help. That is how those suffering from mental illness often feel, but those suffering do not have to feel alone anymore. I have chosen the Mental Health Association of Maryland, or MHAMD for short. This is an amazing nonprofit volunteer organization that is bringing attention to the mental health substance abuse crisis in our state. I am sure I am not alone when I say that someone I love dearly is suffering from a substance abuse disorder. We cannot ignore the fact that mental health and substance abuse go hand in hand, as most of those suffering from substance abuse disorders have a co-occurring mental health illness. After watching my loved one struggle to find the help that he so desperately needed, coupled with the fact that the help once found was extremely expensive due to insurance companies refusing to acknowledge the disease, I became interested in how our state is handling mental health issues. I prepared for this speech by examining the problems that Maryland faces in regards to providing mental health services. I have also examined possible solutions that MHAMD is working on to ensure that those suffering are simply not forgotten along the way. In this speech, we will take a closer look at those problems, as well as solutions being provided and the benefits that this organization offers. For starters, let's examine the problems the state of Maryland faces. The lack of mental health services in our state is hurting our neighbors. Mental illness does not discriminate. As is detailed on this chart, it affects everyone, regardless of race. Did you know that our state is currently experiencing a major opioid epidemic with increased demand for behavioral health services, while at the same time facing huge disparities when it comes to accessing the care needed to treat medical health and substance abuse disorders? Approximately 1 in 5 adults in the United States experiences a mental health illness in a given year. Only 56.8% of those adults receive any treatment for those disorders. That's a little more than half. The remaining receive no treatment at all. Of the 5.6 million people living in the state of Maryland, 3% live with serious mental health conditions like schizophrenia, bipolar disorder, and major depression. Just over half of children with a mental health condition aged 8 through 15 received mental health services in the previous year. Alarmingly, half of all chronic mental illness begins by age 14. Despite effective treatment, there are long delays, sometimes decades, between the first appearance of symptoms and when people get help. Mental health issues not only affect us locally in Maryland, but nationwide as well. The passing of the Affordable Health Care Act had some people around the country falling into a gap where treatment was not available to them. Additionally, according to the article, 5 Challenges of Mental Health Care Today, policymakers are still struggling with what is considered an adequate level of mental health coverage. There are no standards across the board for mental health treatments. A lack of coordination between agencies has created a roadblock in ensuring that those suffering get the best care possible. Serious mental illness costs America $193.2 billion in lost earnings per year. Those living with serious mental illness have an increased risk of chronic medical conditions and often die 25 years earlier than others. And lastly, suicide is the 10th leading cause of death in our country. More than 90% of those who committed suicide showed symptoms of a mental health condition. Now that we know the problems surrounding mental health, let's explore how locally MHAMD is working to find solutions. MHAMD is vigorously working to address the problems that Marylanders are facing when it comes to mental health services. The Mental Health Association of Maryland is one of the oldest advocacy groups in the nation. It was formed more than a century ago when a group of concerned citizens gathered in Baltimore to take action to improve the lives of individuals living with mental illness. The programs they developed formed a solid foundation for the work of generations of advocates that followed. MHAMD works with various coalitions to address mental health from a variety of platforms. They currently team up with a coalition for mental health and aging, behavioral health in the criminal justice system, and children's behavioral health. This provides this charity to become well-rounded in seeking improved services for all individuals suffering from mental illness. Within each coalition, progress has been made. The Maryland Coalition for Mental Health and Aging is working tirelessly to improve the quality and accessibility of mental health and substance abuse treatment for older adults. The Maryland Behavioral Health Coalition has achieved numerous legislative and policy victories in behavioral health, most notably the Mental Health Maryland Health Parity Law, which established an integrated performance-based public behavioral health system and the protection and expansion of funding for mental health and substance abuse disorders. The Behavioral Health and Criminal Justice Partnership works in tandem with local criminal justice agencies to improve reintroduction to the community for those who have been incarcerated. This partnership provides medication upon release, as well as training for employees in the criminal justice field, among other things. After an alarming increase in policy issues and concerns relating to children with behavioral health needs, the Children's Behavioral Health Coalition was founded. This coalition, while somewhat new, is working towards strengthening the bond between school behavioral health supports and improved student outcomes. As was mentioned earlier, MHAMD has been instrumental in pushing for legislation seeking better mental health services for all citizens of Maryland. To that end, they have been very successful. The Maryland Mental Health Parity Law, for one, established that more funding be allocated for mental health and substance abuse disorder treatments. This organization seeks to provide assistance and resources for all citizens of our state suffering from a mental illness or substance use disorder, from young to old to even those incarcerated. Pushing for more funding from the state is just one way in which MHAMD is fighting for our state. They also provide education for mental health professionals and the general public in an effort to decrease the stigma attached to mental health issues. Now that you are aware of the wonderful work that the Maryland Mental Health Association is doing, let's discuss how this organization can become even more instrumental in helping our state. Mental health issues do not just affect those who are suffering, it impacts all of us. Therefore, we could all benefit from helping our friends and neighbors who need us. Imagine if we could just remove the stigma attached to mental illness and substance abuse disorders, that no one should feel ashamed, and that it is no personal failing on their part, but actually a disease. This is the main problem for those suffering. What will people think of me? Will they shun me? MHAMD is fighting to remove the stigma and let everyone know that it is okay to ask for help. There are resources available that can help the citizens of our state get the help they need. Those resources, along with educating our healthcare providers, is going to prove essential in ending this mental health crisis. MHAMD is striving to create across-the-board standards for all mental health practitioners in order to coordinate the best possible services for our clients. With help from the community, people just like you and me, MHAMD led the charge to advance a wide-ranging and robust policy agenda that will increase funding for community mental health and substance use services, stabilize the behavioral health workforce, expand services, and improve outcomes and data transparency. I'm going to wrap this up, but before I do, let's review how we can all help our neighbors who need us. While we are currently facing an epidemic in our state due to a lack of mental health services, MHAMD is vigorously working to address this problem from multiple platforms for all citizens of Maryland, young and old, not only from a legislative standpoint, but from an educational standpoint as well. We all need to get involved and work to remove the stigma that keeps those suffering from either mental illness or substance abuse disorder from seeking the help they desperately need. On a micro level, we need to remove the prejudice from our minds that labels anyone else as less than. On a macro level, we need to get involved, as this crisis does not only affect those suffering, but it impacts all of us. Every one of us will reap the benefits of fostering a loving environment that encourages seeking help over hiding out. Please consider volunteering to help MHAMD. Donate some of your time to attend legislative meetings to encourage our state to protect funding for our community behavioral health services. Consider calling your representative to voice your support for more funding to be allocated to mental health services. Visit the MHAMD website for any upcoming marches in Annapolis to highlight the mental health crisis. Any and all help, large or small, is greatly appreciated. Thank you.